I want to start off tonight by telling you a little bit about how I got interested in the whole concept of communication. Tonight we're going to be talking about communicating periodontal protocols and then also implementing behavior for our patients. Or to simplify that, because that's what tonight's going to be about, is simplifying communication, keys to communication. So I want to share with you some of my two favorite patients. I graduated from the Medical College of Georgia as a hygienist, and my first year, my two most memorable patients, I'm going to share that story with you first. The first one was a truck driver, and he came in and he presented with lots of perio. Okay, so I had him scheduled for several quadrants of scaling and root planing. I gave him all of my patient education best because, you know, I graduated at the Medical College of Georgia. They taught us patient education. We learned about prevention and we learned how important that was. So I gave him my best patient education, told him everything I needed to tell him. And when he left, I thought, I doubt if he'll get it. He didn't seem to get it. Because I thought he seems like he has a low, what do we call it back then? IQ. Dental IQ, right? That was my first memorable patient. My second memorable patient was a bank president. And I was very excited because I knew that he would be very open to all my patient education, all the things that I had to tell him. He was a prophy patient, but after I examined his mouth, I realized he wasn't going to be a prophy for long. He was headed straight for perio. So I also gave him my best shot, all of my patient education information. I told him and told him and told him. And about halfway through my spiel, he patted me on the arm very patronizingly and said, little lady, I don't need a speech today. I just need for you to clean my teeth quickly because I need to get out of here because I have an important business meeting to go to. So can you please hurry? I was crushed. I was crushed. I didn't get to finish my patient education spiel with him. How was he going to learn? How was I going to save him from periodontal disease? Okay. I learned two lessons from those two patients. The first patient, what lesson did I learn from that patient? Don't judge a book by its cover. All right? We can never, ever, ever presume to know or think we know what our patients are capable of accepting or agreeing with or will comply with. Okay? We can never assume that. What I learned from patient number two, my second most favorite patient, the bank president. Never judge a book by its cover, right? Same thing. I also learned after that, you know, there's got to be something more to this patient education. There's got to be something more to this. Everybody doesn't get it the same way. So that began my quest for finding communication tools and techniques that work. So over the years, I've listened to some great speakers and utilized a lot of different things with my patients, and that's what I do now. Most of my speaking and writing, whatever topic you see it on, it has to do with how do we communicate to the patient that in an easy way the patient gets, okay? So, and it's not just getting. We're not successful until we elicit some sort of behavioral change, right? Because our patients can nod their heads all we want, but if we're not actually getting compliance for our treatment, then we haven't really made that next last step. So tonight, I want to talk to you about, I'm going to share with you communication tools to make it easy and simple for you to communicate these rather complicated protocols to your patient. Easy for you to explain, easy for them to understand, and also effective, okay? Techniques that work. And finally, I hope to throw in a little humor, a little fun, because dentistry can be serious business, right? So the more you can make it a little more fun for you and your patients, the more effective you're going to be and the more fun you're going to have. So, speaking of dentistry being serious, periodontal disease is serious. It is the number one, the most infectious chronic disease, not just in this country, but on the whole planet. Pretty powerful stuff. And we now know, I'm sure all of you are aware, research comes out constantly about the oral systemic connection. Okay, Richard Nagelberg says it's sort of an oxymoron because, of course, there's a connection between the mouth and the rest of the body. You don't say the eye connection with the rest of the body, the gut connection, the ear connection. We know everything's connected. Somehow in dentistry, we made this disconnect. But all the research now is showing huge links between periodontal disease and heart disease, problems with babies being born, and diabetes, and even obesity now. So we're not going to get into a lot of the clinical aspects of periodontal disease tonight, but I think most of you have been keeping up with the research and are aware that this is huge. There's a whole organization that has started recently as a result of this very connection, putting the physicians community and the dental community together. It's called AOSH, American Association of Oral Systemic Health, and that's the whole purpose, is to put those entities together so we can work together. So what can we do at our end in the dental industry to help our side, which is finding, diagnosing, and being able to treat periodontal disease for our patients? So we said periodontal disease is the most infectious chronic disease in the world. What does it look like in our country? What are the statistics for periodontal disease in the United States? What does the ADA say? What percentage of patients in our country have periodontal disease? 80%? Anybody else? 80? 75% is the statistic, okay? So if 75% of our patients have periodontal disease, that means only 25% of them are healthy. So hygienists in the room, how many hygienists do we have? Awesome. If these are the demographics, 75% of our patients have disease, then what percent of our procedures should be perio procedures? 75. 75. Yeah, you probably heard that a few times from your Ora-Pharma folks. Do any of you hygienists know exactly what your percentage is? Anybody want to share it? I can tell you across the country, Adam mentioned I was at one time for 5 years the director of hygiene for a large group practice. We had over 120 offices, I think, at the time. So we were able to see lots of numbers over lots of demographics very, very quickly. And we weren't near that, okay? And this was an office of over 100. We grew it when I was there, but the national average is 20 to 1, 20 prophy patients to 1 perio patient. This is the national average. So why is that? If so many patients of ours are sick with periodontal disease, why are we not treating them? Okay, why is the statistic? Well, because a lot of times the patients don't understand the value of their treatment. Would you say that's a lot of the time? Probably the majority of the time. And we don't always do an effective job of communicating the value. I certainly didn't to my 2 favorite patients that I remember, all right? And I don't think it's because we don't want to. We're trying really, really hard, but we may not be as effective as we could. Sophocles, the famous philosopher, said, "Look and you will find it. What is unsought will go undetected." What is unsought will go undetected, which is why we perio chart and take full mouth x-rays, because we're looking for periodontal disease, okay? We're not going to find it if we don't look for it. I, for many years, temped in Atlanta. Any hygienists that have ever done any temporary work? Was it fun? She's not sure. It's a challenge. You have to be a special kind of hygienist to do temp work, to go in an office cold, not know anybody, not know the team, not know the systems, not know the patients, and be successful. So I temped for one summer for an office that had 2 hygienists. One was on pregnancy leave, and I took her place for the summer. I always would go in an office and briefly discuss with my doctors, are we on the same page in terms of our philosophy of periodontal disease? Because I wanted to make sure that what I was sharing with the patient reflected the doctor's philosophy. So we were on the same page, and I did what I was doing. I was converting prophy patients to perio when it was appropriate. 2 weeks later, I walked into the office and I heard the other hygienist having a conversation with the doctor. And it sounded like they were talking about me, and it wasn't good. And apparently she was complaining because I was doing too much perio. And then I heard her say, but she's looking for it. In exasperation and frustration, she said to the doctor, but she's looking for it. Yes, I was. I'm looking for it. So we're not going to find periodontal disease if we don't look for it. So we now know that we need to look at it much more aggressively than we may have been in the past. So if you're not looking for it, be looking for it. I don't know what your particular periodontal protocols are. For me, when I was in charge of over 150 hygienists, the protocol was complete 6-point full mouth probing on every single new patient, full mouth x-rays, and actually we had a really cool protocol where we did full mouth and a pan on the first visit. Then after that, probing depths were measured every time we saw the patient in hygiene, recorded and documented at least once a year, complete 6-point. Okay? You may have something similar to that. Many times, all we see is the tip of the iceberg. Okay? That's why we look clinically deeper to find periodontal disease. But I want you to sort of understand also that this works with communication too. Because our patients come in, and a lot of times, this is all we see right up here. We see the tip of the iceberg when our patients walk in. But our patients have what I call baggage. We all have our baggage. We have our stress from our job, we have our families, we have our financial stresses. We have a lot of stuff that we carry around with us all the time. Some of it's good baggage. Some of it's I'm totally preoccupied because I'm getting ready to go on vacation and I am so excited I can't think about anything else. All right? But a lot of it is distressing, distracting baggage. So how do we put ourselves in a position to understand that and use it in a way that's going to help us to do, of all things, enroll a patient in periodontal therapy? Okay? So the first thing we have to understand is we need to get to know our patients a little better, figure out what some of this baggage is that's going on, get to know their values, and how in the world do we do all that in the short bit of the thing we have the least of in dentistry, and what is that? Time, exactly. So we're going to talk about really getting specific in your vocabulary and your communication skills to find out as quickly as you can what all this stuff is going down underneath. So some of our concerns, when we don't clinically share everything with our patients is because we're afraid. Sometimes we are afraid that they're not going to understand the value or that they'll refuse treatment. I mean, are you ever worried that your patients are going to refuse treatment if I tell them they've got all this perio disease when they only came in for their what? Free cleaning, thank you, okay. Or that they'll leave the practice, doctor's going in and he's finding all this treatment and the patient says, you must need a new Mercedes. My last doctor didn't tell me I needed all that. And I went to him for 8 years, right? Or it's difficult to discuss fees. It's hard for all of us too. Well, maybe not all of us. Maybe there's a few financial coordinators in the group that love to discuss fees, and great for you. So we have these concerns. Are you a financial coordinator? What's your name?
She's Amanda.
Amanda? Our closer. Okay, awesome. What's your name? Amanda. Okay, well, Amanda, we're going to get back to you later because you're some of our most favorite person in the office. We depend on you a lot. So what I want to talk to you about is the difference between education, patient education as I learned it, and as I suspect many of you may have learned it too, and actually communicating, what I call more creative communication. So I looked education up in the dictionary, and it says things like results produced by instruction, all right? That's what I did with my two favorite patients. I instructed them, or the process of imparting knowledge. But I can impart knowledge to you all day long. Does that mean you're going to actually take action and do something? You might not. Do you know smokers that know that smoking probably is a really big risk factor for lung cancer? Okay, we know a lot of people that know that smoking is a really dangerous thing, yet they don't quit. Why do they not quit? There's a whole lot of baggage and emotional stuff tied around that and why people smoke, okay? So patient education doesn't necessarily translate to a change in behavior, okay? One of my favorite cartoons is the cartoon of this little boy. Anybody here a dog lover? I love dogs. I'm a volunteer for Canine Assistance. We help breed and train service dogs for disabled people. So I get to be around a lot of dogs. Gotten to know dogs really well in the last couple of years. But this cartoon is this little boy, and he's telling his dog, sit, stay, shake, down. And the cartoon balloons are going, the dog's looking up at him, you know, like just adoringly. But what he's thinking is blah, 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 blah. All right. So have you ever been in the chair, or have you ever had a patient in your chair when you did your very best to give them patient education, to explain to them why they needed a crown, or explain to them this little measuring stick, and we're going to go under your gums and see how deep these pockets are? And did you ever feel like your patient was going blah, 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 blah? That's the deer in the headlight syndrome. That's the time that you need to step back and go, I need to reevaluate where I am here. I can't go further because I don't have what it takes to move forward with my communication. Let me step back and see if I've done all my homework. So let's talk about that homework. So you need a call to action, all right? And it needs to not be random. It needs to be carefully thought out. So you need to be thinking about your communication. Once you get good at all these skills, it'll come pretty much naturally, second nature. But right now, it needs to be thoughtful. Okay? We need communication. We need to be implying a sense of urgency. Periodontal disease is serious. No, we can't wait to train it. No, to treat it. No, we can't do a prophy now and then do perio treatment later. It's a sense of urgency, but at the same time, we don't want to overwhelm our patients. So there's a fine line there, all right? We need to deliver enough information, but we don't want to overwhelm our patient. So there's another fine line. And finally, we want to enroll our patients in treatment acceptance so they actually change their behavior. This isn't one silver magic bullet. This is a process. And it happens throughout your whole appointment. It happens before the appointment. It happens after the appointment. So we're going to talk about all the pieces of that process tonight. So we need to know, how do we establish rapport very quickly with our patients? And that's with our patients that we know as well as new patients as well. I'm going to share with you some values questions and how you can relate the answers to those values questions to how you present treatment. One of the most important things that I'll share with you tonight, the values questions and how to use those effectively. Difference between focused communication and casual conversation. Then I'm going to share with you the treatment triad, the secret to presenting treatment to patients, no matter how long that list is, and making it thorough instead of overwhelming for your patients. I've had offices tell me that treatment triad, they've tripled their treatment acceptance by using it. So I hope you'll be able to do that too. I'm sure you will. And finally, we're going to talk a little bit about some transformational vocabulary. A lot to cover tonight. I'm going to try to get you out by 8, all right? So we want to talk about the whole experience of being in the office, the rapport, the trust, the building relationships. So we need to establish and build trust and maintain and deepen our relationships before you can have a periodontal conversation. You can't have a periodontal conversation until you've established these things first. So how do we do that? Trust is defined as ability, strength, integrity, and character. So translated to the dental world, your ability is your clinical expertise, your dental expertise. So how many of you think your patients come to you for your clinical expertise? Do your patients leave and go, oh, Dr. Klein is so good. Do you know the margins on that back crown are just so smooth? I've never felt such smooth margins. He's great with occlusion. That hygienist, that scaling and root planing, no, they don't really know whether we're good or not. Indeed, there are some practitioners that aren't very good clinically but have very good communication skills, and their offices are more successful than other practices where they may have better clinical ability, but they don't have the communication skills, okay? I'm assuming all of us have great clinical ability here tonight, okay? Strength. So how do our patients tell if we're any good or not? How do they know? Well, one of the ways they know is when you tell them, okay? You need to have the self-confidence and the core beliefs in what you're doing to be able to share that with your patients with self-confidence. That's how your patients are going to feel confident in your clinical ability, because they really don't know. Okay? And finally, trusting your professional character and your professional integrity. And that has a lot to do with how you all interact as a team and create trust for each other for the benefit of your patient as a patient advocate. So when your patient first comes in, you want to do a lot to reassure them. Remember, all these things need to be in place before you can talk about periodontal disease. Okay? So you need to reassure them and pre-frame them with things like, you know what, you have come to the right place. You haven't been to the dentist in 8 years? Don't worry about it. You know what, we have a lot of patients that have been afraid to go to the dentist. You're in the right place. Suzanne, our hygienist, she specializes in people who haven't been to the dental office, all right? What do these things do for you? When you acknowledge this, you're doing several things. You're acknowledging that your place is the right place. So your patient, when they leave, they're not thinking, I don't know about this periotherapy. I think I might want to go get a second opinion. They're leaving going, wow, these people are so self-confident and they're such a great team. You've been bragging about each other the whole time, all right? And, oh my gosh, I'm going to go see Sue, and she's seen other people just like me that haven't been to the dentist. And they know I haven't been to the dentist, but they're not mad at me. I'm not getting a scolding. So now what happens when you introduce some perio? Your patient's prepared because you've already had this conversation that you haven't been to the dentist in a while. Okay? So these are things that I call setting your stage for success. It's crucial to set the stage for success. Dr. Jones is an expert at whatever your doctor is good at or likes to do, brag about that. Our doctor is the best at that. You're going to love him. You're going to love his assistant. Okay? Brag about your team. Focused communication versus casual conversation. You know, as hygienists, we are social people, and I don't know how many years of experience we probably have cumulatively amongst us, but we get to know our patients. We have conversations with them. We have a lot of casual conversations in the treatment room. I'm seeing some heads go up and down. So much so that do you sometimes find yourself going, oh my gosh, I've had such a good time, I better get started cleaning their teeth, all right? We run out of time. Oh, I'm seeing fingers pointed, okay? So what I want to help you do is take that conversation and make it more focused communication. You're going to learn about your patients, and you're going to be able to use that information to customize your treatment planning for each patient. So you're not looking at the tip of the iceberg, okay? The first thing seems very, very basic, but it's huge. Start your appointment, start your conversation on a positive slant. Tomorrow, what great has happened to you today? What do we usually say when somebody comes? What's the first thing you say? How are you? And what do patients bring in with them? Their baggage. So if they're having a bad day, they're going to tell you about it because you just asked, how are you? I learned this from my friend Christoval, who's a fantastic hygienist in West Washington State. She said, when I started asking my patients, what kind of a great day are you having? What fun did you have over the weekend? What are you doing this weekend for fun? When I started pre-framing every one of my appointments with that, she said, it was remarkable, the change. So you have a patient that comes in, they already are stressed out from their day or the traffic or their kids or whatever, and then you get to tell them that, guess what, now you've got periodontal disease and you have to have hundreds of dollars worth of treatment instead of your cleaning. Okay, so what if you pre-frame the whole appointment with helping to be their patient advocate, to get them to look at the glass half full instead of half empty? How easy and how simple would that be? So I challenge you to change how are you to what fun did you have over the weekend? What did you do for fun? What are you going to do for fun this weekend? What's the best thing that's happened to you this week? Okay? Also, we're going to be talking about asking open-ended questions. Everybody know the difference? A closed-ended question is a question that requires a yes or no answer. Mrs. Jones, do you floss every day? Oh yes, Janet, I do. Well, when I remember. Okay? A better question would be, tell me about your home care. right? It's easy to answer yes and no. We don't have to turn our brain on to think about that, all right? But when you ask me an open-ended question, I have to think about that to answer that. And you get a lot more information from people, okay? This is one of your pearls for tonight. As you're getting ready to talk about periodontal disease, ask your patient the open-ended question of, what do you know about periodontal disease? What do you know about periodontal disease? What kind of answers do you think you might get?
Nothing.
Nothing, okay. What else? What kind of answers do you think you might get?
I think it's gingivitis.
Pardon me?
They think it's gingivitis.
They think, do they say that? I think it's gingivitis?
Well, they say it's gingivitis. I'm like, no.
Okay, where do you think they got the word gingivitis?
It's probably more common.
Probably more common. Maybe TV, because we do see that on TV sometimes. What other answers do you think you might get? Tell me, Mrs. Jones, what do you know about periodontal disease?
I don't have it.
I don't have it, okay? Whatever it is, I don't have it. Do you think they might say something like, oh, I guess it's that gum disease stuff, but gee, I hope I don't have it because I take care of my teeth, right? Okay, like they might think that you have to be a really trashy mouth if you have gum disease, okay? What were you gonna say? My parents have it. My parents have it, okay? Would that be, no matter what they say, would that be the perfect opportunity for you to say, you know what, Mrs. Jones? Actually, interestingly, did you realize that 75% of the people in this country have some form of periodontal disease? Okay, so now your patient's thinking, well, gee, I wonder if I have it, okay? And if I do, there's a lot of other people that have it too. All right, this is a huge question because it's going to give you a lot of information. She said, what if I say my parents had it? Wow, well, we do know that there is some genetic predisposition to periodontal disease. And we now know it has all these oral systemic links. Thank you for sharing that with me, Mrs. Jones. What's your name?
April.
April, thanks for sharing that with me, April, because we are going to be really looking into that for you now that I know that you have a family history of that. Okay? Do you see how this question can be huge? Ooh, that looks good. All right. So starting your conversation off in a positive slant, asking open-ended questions, and tell me what you know about periodontal disease. Okay? We want to listen more than talk. We want to do the opposite of what I used to do when I thought I was educating my patients. You know, a lot of people say God gave us 2 ears and 1 mouth, and there was a reason for that, okay? So we want to ask good questions and listen a lot, because your patients will tell you so many things that are going to help you present their treatment in a way that they're going to get, okay? And then you want to look for opportunities to link your patient comments that you get with your clinical observations. So as you collect data, you're going to be doing what I call this discovery process. So as you ask questions on your medical history, for example, if your patient has a history or anybody in their family of diabetes, heart problems, these are going to be your opportunities to say, that's very interesting. You know, we now know that there are links to periodontal disease and the rest of the body, particularly these diseases. So we're going to be looking for this more aggressively. We're going to be screening for that for you today. Does that make sense? Screening for that for you today. Also, as you're getting to know your patients on a more personal level, look for links, particularly with your new patients. Look for links personally. In other words, if your patient's kids go to the same school that you go to, if they're new to the neighborhood, if you play golf, if you're tennis players, by looking for things that you have in common, good salespeople know how to do this well. They get to know their clients first, and they look for personal links to give them something in common before they start talking about whatever it is they have to sell. So this is huge. I once did a workshop, a team workshop with a bunch of doctors, and this was the assignment. The assignment was to sit down and pretend that I was the new patient, and each doctor came up, and their their job was to introduce themselves to me as if I was the patient, and for 2 minutes we had to have a conversation that had nothing to do with dentistry. And it was almost impossible for them to do because we are so conditioned to be talking about dentistry. So get to know your patients a little bit. And you don't even have to ask them these questions. You can look on their medical history and their forms and see what they put down and ask them questions about that. Okay? So linking. Linking is really important. Okay. Are you ready to hear the values questions?
Yes.
Are you really ready to hear the values questions? All right. These are the values questions. When it comes to your teeth, what's the most important thing to you about your teeth? What kind of answers do you think you'll get? My smile? How white they are? What else? What's the most important thing to you about your teeth? Breath? How they look? Breath? What else? How they look? Oh, did somebody say keeping them? Did I hear that? Want to keep them? What else? What other answers do you think you're going to get? When it comes to your teeth, Mrs. Jones, what's the most important thing to you? You can ask your patients this even if you've known them for years. You know, I never have asked you, Mrs. Jones, what is the most important thing to you about your teeth? Any other answers that come to mind? Most of your answers that you get are going to fall in one of two categories, cosmetic or functional. All right? I'll give you the example of my patient. I'll call her Pam, that came in one day to get her teeth cleaned and said, Janet, just clean the front ones because I'm going on vacation and I got to go shopping. I'm in a hurry. Just clean the front ones. True story. Was she functional or was she cosmetic? Pam's totally cosmetic. She dresses to the hilt. Neiman Marcus is her favorite place. She's always got her nails done. Her makeup is there. So do you think that's going to change how you're going to talk to her about getting a crown or periotherapy to know that she is totally, totally cosmetically oriented? Okay? What about the other extreme? The patient who says, Janet, to tell you the truth, I really don't care what my teeth look like. All right? If I wasn't married to a hygienist, I wouldn't care at all, right? But I do want to make sure that they last. I mean, I want them to be strong and healthy and functional, all right? Are you going to tell him about the beautiful cosmetic work your dentist can do? Nope. You're going to tell him about the function, right? Or the function and foundation of the bone to keep teeth in place. Okay. And then you have people like me. You know, as that commercial says, I want it all, I want it now, and I want it delivered. I want it cosmetic and I want function, okay? So you're going to have some patients that can go either way, and that's great. So you need to know, is your patient cosmetically oriented or are they functionally oriented? So if I'm enrolling that patient in periodontal disease, I'm going to tell them if they're functionally oriented, I'm going to talk to them about the foundation, the bone's what holds your teeth in place. If there's no bone there, if your bone's all gone, then your teeth are going to fall out, okay? Right now, we've lost some bone. We don't want to lose any more bone, okay? If it's a cosmetic patient, I'm going to talk about how ugly it looks when we start getting a lot of loss and maybe a breath problem as well, and arresting the problem from a more cosmetic side. So that's the first patient values question. Your patient's values, what's most important to you about your teeth? What are the two answers? Cosmetic and function, okay. And would it be helpful if when you're in the office and you asked the question and you got the answer, if you found a little place on the chart and everybody knew where that place was going to be, and you just put a little C or an F and circled it on the chart so that the next person that saw it, the assistant to the dentist, could see it too, okay? Communication within the office. So now we're getting a little bit of an idea about where this patient's coming from. Second most important values question is, what's the most important thing to you about going to the dentist, the office, when you come to see us, the whole experience? What's the most important thing to you? What kind of answers do you think you might get?
Least expensive.
The least expensive. Who said that? Usually takes a while for that. Least expensive. What else? Time? Yeah, who said time? We don't want it to take a long time? As in? Okay. What else? Pardon me? The appearance. Possibly. What else? The staff. Are they what? Friendly or helpful or? What else? You guys started off really good. Insurance. Will they take my insurance? That sort of goes with, is it not too expensive, right? What else?
You want what insurance pays for.
Right? What else? Nitrous. Bingo, you hit it. Okay, so nitrous comes close to the third thing. What are the top 3 things that keep people from going to the dentist? We know that only 50% of the people in the country go to the dentist. Top 3 things that keep people from going to the dentist is fear of pain, which is why we want the nitrous, right? So we have pain is one, fear of pain, money. I'm afraid it's going to be too expensive. And time. I've got money, but I just don't have any time, okay? So if you were, whatever answer, you can see it can come in a lot of varieties. And you have to be good enough to know if they say something like nitrous, well, that means that they don't want to be in pain, okay? They want to be comfortable, all right? So do you think that that's going to be helpful if you know which trigger is your patient's? I mean, most people are going to have a little bit of all of this, but there's going to be one that's going to stand out. That's the one that they're going to tell you. So if you have one patient that's really time sensitive and another person that's pain sensitive, are you going to explain periodontal disease to them in the same way? No, absolutely not. One, you're going to say, we need to treat this now before it hurts. Okay? Typically, periodontal disease doesn't hurt until it gets really bad. So we want to treat it now before it hurts. The guy who's time sensitive or the woman who's time sensitive, you're going to say something like, let's take care of this now. This is urgent. And then after that, you're going to have to maintain your appointments. We're going to have a maintenance program for you. I know that you're out of town a lot, so let's go ahead and get this scheduled in some sort of priority so we can do this and work it in with your schedule, all right? So this doesn't become an emergency and you have to take time off work. Let's work it in your schedule. You're basically saying the same thing, but you're customizing it for what that patient's needs are, okay? So that's one more level of getting into what that particular patient's baggage is, all right? They're good baggage, they're bad baggage, whatever. So once again, if you had a place on your chart where you could document that, and then that way other people in your office would know too. So does that make sense? Can you see where these values questions can be really helpful? You're not going to be able to have a periodontal conversation until you can start laying these success steps in place. Okay, so we've laid the foundation, we've set up some foundational steps. Now it's time to do some presentation. We're going to have to look for the disease. We're going to do a complete exam on the patient. We're going to look for everything, and then we have to tell the patient that, and then figure out a way to get them to want whatever treatment is we find that they're going to need. So the comprehensive exam, we're going to need to take x-rays. We're going to look at existing restorations, and then we're going to look at any restorations that might be needed, crowns, fillings, whatever. We're going to do a complete periodontal evaluation. We're going to do 6-point probing. We're going to do occlusal relationships. Check that. We're going to do a complete head and neck exam. Hope everybody's doing head and neck exams and oral cancer screenings, right? And then we're going to look for immediate preventive treatment. And then, by the way, there's a lot of cool things we can do for aesthetic dentistry. That's a lot to give a patient. So my question to you is, they say that something like 3/4 of all the crowns in this country are done one at a time, not quadrant dentistry, all right? So are we going to present the patient with all this treatment at once and be fearful that they're going to be overwhelmed, That's our fear. If I give my patient all this information, if I tell them everything that I found in their mouth, are they going to be overwhelmed with that? So this is the key to getting overwhelmed. And it's real simple. It's called the treatment triad. It's urgent, preventive, and cosmetic, those three things. Urgent is what I call 911. Preventive is what needs to be done, but we just don't need to do it now, but we need to do it. And cosmetic is fun. It's extra. It's the lagniappe. Y'all know what lagniappe is? The extra, it's a Cajun term. And it means you get what you pay for, and then a little bit extra. So it's the extra. It's icing on the cake. So this is what that sounds like. I'm going to do the restorative version, and then I'll do the perio version. All right, so the restorative version is something like, Mrs. Jones, we're going to be taking a look at your mouth, and I'm going to be looking for 3 types of things. I'm going to be looking at what you may need that's urgent. We call that 911. I call it 911. It's like that tooth in the back that's broken, but you didn't really need us to tell you that because that's why you came in. So you knew when you came in that that needs to be fixed. So that's the first thing we're going to look for is urgent care, what needs to be done right now. But we're also going to be looking at preventive care. So I can see that you have a lot of old metal fillings. I never call them amalgams. I call them old metal fillings. And those are going to need to be replaced so they don't become 911. But we can do that. We'll work with your budget. We'll prioritize it. We could do a quadrant at a time. We could take a year to do it. But we'll prioritize that and take that a little at a time. We'll chunk it down. And finally, I know you put on your chart that you'd like to have your teeth whiter, and we can do that for you too. So we're going to talk about all kinds of cosmetic options, which is totally unnecessary, but it's just fun to look at. And that's the fun part of dentistry today is we get to do a lot of really life-changing, wonderful cosmetic stuff. So if that's okay with you, that's what I'm going to be looking for, these 3 types of treatment. Okay? The periodontal version is similar. It's same thing. I'm going to be looking for 3 types of things when I do your periodontal screening today. I'm going to be looking for areas of active infection. These are areas that are bleeding. They may have some pus coming out. Patients going, ooh, not that. Yes. So this is an area that's going to need to be treated immediately. Okay, we can't wait. We need to fix infection right now. Also, we're going to be looking at, if it's necessary, there may be some maintenance involved here. There might be things that we need to maintain over a period of time, ongoing, depending on the severity of your case, if that fits in. So we'll look at that and we'll schedule that at intervals to work with your schedule. Okay, that's your periodontal maintenance. And finally, I know you said you wanted to get your teeth whiter, and we're going to look at that too, but first we need to make sure that we have a good foundation, all right? It's like you wouldn't wax a dirty car. You'd want to clean the car before you waxed it. So we're going to be looking at that in order to do some of this cosmetic work that you're going to do. So does that make sense? You're chunking it down to urgent. Patients usually will do what's urgent, all right? Then the hard thing is getting them to come back and maintain, so you're going to prioritize that and let them know we're going to work with you on that so they have a voice in their treatment. And then finally, you're going to add some icing on the cake and talk about some fun things we can do for you in dentistry. Does that make sense? Now, you've gone from your patients saying, oh my gosh, why did my last dentist never find all this? Why did my last hygienist not tell me that she found all this? Okay? To, this is what you'll hear, that is the most thorough exam I have ever had. All right? Because now they know you've given them the big picture, but you're also chunking it down. Does that make sense? Okay? Treatment triad. I've had offices that I worked with that I shared the treatment triad. They printed it out, simple little treatment triad, those 3 words, taped it to the inside of their cupboards and all of their operatories. 6 months later, came up to me and said, I want you to know we've been using that and we have tripled our treatment enrollment with our patients, all right? So I challenge all of you to use it and email me and let me know if you've tripled your treatment enrollment as well. I'll look forward to that. All right, what kind of terminology does your practice use? Not only for periodontal disease, although we're going to talk about that specifically tonight, But I'm curious to know, do you have agreements in your office about what kind of terminology you use? So you don't have people using different terminology and the patient gets confused, and what do? They're going to go home and think about it, okay? Because you haven't made that clear. So we're going to talk a little bit about what I call transformational vocabulary. There are some words that just are more effective, they're more powerful. As a writer, we use thesauruses to find better words that sort of mean the same thing but have more impact. I actually have several books that are for writers that are just about power words. So I kind of know what I want, but I look up that word and it'll give me 10, 12, 15 other words that mean something similar but are more powerful. So we're going to talk about some ways to have more powerful words. On a very general, broad basis, just a simple thing like always referring to your appointments as your reserved appointment time. You're reinforcing the reserved part of that. We can talk about communicating periodontal protocols all night long, but if there's not a patient in the chair to share it with, it doesn't do us any good if they've not shown up for their appointment. So reserved appointment time, always. I will never say we had a cancellation. Our patients love us so much, they never cancel. Instead, I will always say an unexpected change in our schedule. All right? So for the office managers or any of you who handle the appointment book and handle people calling in, never say, we've had a cancellation today, you want to go? We have had an unexpected change in our schedule. Doctors had an unexpected change in our schedule, and the good news is, if you'd like to come in today a week early, we can handle that for you, all right? Now let's get down to some really important power words for those of us who are talking about periodontal disease. Even though we know that inflammation and infection are very closely related, and we know that if there's infection going on in your mouth, that means there's some level of inflammation in your body. When I talk about periodontal disease, I don't use the word inflammation. I don't say your gums are inflamed. If they're bleeding, you're infected. All right? You have an infection. People understand the word infection, and it carries with it a sense of urgency. And that's what we want. We want them to understand a sense of urgency. When you've got a chest infection, what do you want? You go to the doctor, what do you want? You want an antibiotic. Yes, you do. When your baby has an ear infection, you take your baby to the doctor, what do you want from the pediatrician? You want an antibiotic. So people, the mainstream people understand infection, they understand antibiotic. So when you're talking about you have 5 spots in your mouth that are bleeding, there's active infection going on, that's going to get your patient's attention a lot more than saying, you know what, we found a little inflammation going on in there. It carries no sense of urgency. So start using infection instead of inflammation. You've got a little bleeding, you've got a few cavities. No, don't use those minimizer words. Instead of little bleeding, you have a chronic bacterial infection. Once again, we're using the word bacteria. Nobody wants bacteria in their mouth, all right? And chronic. A problem area. I see you've got some problem areas. Maybe we ought to just floss a little bit better back there, all right? No, you've got a chronic bacterial infection. It's gum disease, and we need to treat that, okay? And this is my personal favorite, and I'm going to talk about it a little bit longer. The next word is, it's a phrase that you'll be familiar with, you hygienists, deep cleaning. I don't know how many of you still use the phrase deep cleaning instead of to call it periodontal therapy, but think about this for a minute. Deep cleaning is an outmoded word. It's a phrase that has no meaning whatsoever. Hygienists, I ask you, what is the code for a prophylaxis? What is the dental code, the CDT code? 1110. What is the code for quadrant scaling and root planing? 4341. What's code for periodontal maintenance? What's the code for debridement? Thank you. What is the code for a deep cleaning? There is no code for a deep cleaning. It is not a dental procedure, all right? So we're going to go by our code. It is not a dental procedure. If you're still using deep cleaning, that's when your patient is going to go up to Amanda. Amanda's going to see me and say, Janet, the hygienist asked me to schedule you for deep cleaning, and that's going to be so much money. And I'm going to say, excuse me, Amanda, I'm not paying that much money for a deep cleaning. And Amanda's going to say, oh, but Mrs. Hagerman, let me explain. This is not just any cleaning. This is a deep cleaning. It's a really deep cleaning. You need a really deep cleaning. And Mrs. Hagerman is going to say, I don't care what kind of cleaning it is. I'm not paying that much money for a cleaning. I'm going back to my old dentist. All right? So it is an outmoded expression. It's obsolete. Don't use it anymore. As you use that, your compliance is it's going to be incredibly difficult if you're going to use the term deep cleaning. So use periodontal therapy. To me, that is the easiest. It's easier than saying scaling and root planing, but this is therapy, and this is designed to remove the bacteria that's causing the infection, okay? If your patients want more information, they'll ask you, but this is the simplest and the best way and the most effective way to get your patients' compliance. We need for our patients when they leave to know this is a disease. I have an active disease that needs to be treated, okay? And the last word is the word just. You just have a little bleeding. You just have a few cavities. It's just a little inflammation. Just is a minimizer, all right? It minimizes whatever it is you're getting ready to say. Just don't say just. Unless it's Amanda, and she's going to be saying, Mrs. Hagerman, your treatment plan is just going to cost $20,000, right? Right, Amanda? Okay. Seriously, be mindful of the words that you use, okay? Be mindful of the words that you use and the impact that they have, all right? Very, very important. Transformational bacteria, terminology, vocabulary. So standardize your terminology and stick with it. Everybody in the office needs to know that. So when you go back to your offices, you might want to have a staff meeting about the word deep cleaning and coach each other, all right? So if Adam and I are on the same team and we can hear each other because of the way our office is set up, Adam and I may have an agreement to coach each other. So if he hears me using the word deep cleaning, he has my permission to go up behind the patient, but in front of me and go, or whatever little code we have. So I'm going to go, oh gosh, I used that phrase again, all right? So you're going to help coach each other throughout the day till everybody gets it, all right? So as a team, you're going to stick to it. You're going to have everyone in the office using the same terminology, every patient, every time. Aristotle said, we are what we repeatedly do. So excellence then is not an act, it's a habit, all right? It's not that one time when we were excellent. It's doing it over and over and over again, the habit of excellence. So decide what you're committed to, stick with it every time. Make that your goal. How are we going to implement all this? We're going to talk about neutralizing common patient objections, all right? So we're going to use some tools to do this by confirming what we heard, understanding that we heard the patient right, acknowledging what they're feeling, all right, their pain, and then help them problem solve that. So what would that terminology be like? We're going to practice empathetic listening. We're going to use visual tools, additional medical information if our patients need it, and then using standardized terminology. Let me share with you one of my favorite scripts for empathetic listening. And it's really, really old. And it's old because it's been used for so long, and it's because it works. 3 words: feel, felt, found. Wow, Mrs. Jones, I know exactly how you feel. And you know what? A lot of our patients have felt the same way, and this is what they have found. Gee, Adam, I can certainly understand your concern about the fact that you've got periodontal disease. And you know, we talked about the fact that 75% of the people in this country have some level of periodontal disease. The good news is that we can get you to a point where we can control it. So most of our patients have found that once we get this under control, their breath situation goes away, their bleeding goes away, and we can keep this at a steady level. So I know exactly how you feel. Believe me, lots of our patients have felt that way. Or if you're in a position to empathize with them personally, you can say, I know exactly how you feel. You know what? I've got periodontal disease too. Early stages, we've got it under control, but I know exactly how you feel, all right? And this is what our other patients have found. I know exactly how you feel. I know a lot of our patients often ask questions about if their insurance will cover treatment or not. Everybody's concerned about finances and how to finance the treatment that they need, all right? When you get those sticky questions about, will my insurance cover this? Instead of getting real defensive, basically, stop. I know exactly how you feel. You know, practically all of our patients ask that very same question, so I'm really glad that you asked it too. It lets me know that you're probably a fiscally responsible person. Let me tell you the good news. Most of our patients have found that we're in a position to help make dentistry affordable for them. Amanda at the front is our financial coordinator, and she is absolutely awesome at maximizing whatever insurance benefits you have. And let me tell you, there's so many different plans. It would take a year of Sundays to figure them all out. But she's our expert in the office at that. She'll help you maximize your benefits, and we will do everything to make dentistry affordable for you. But you start out with, I know exactly how you feel. Thanks for asking that. I used to feel the same way. Believe it or not, I used to feel the same way. But what I found was, or our patients have felt the same way, and this is what they have found. Okay? So that feel, felt, found is a huge way of practicing being an empathetic listener. Taking advantage of visual aids. We're going to talk about visual aids in a minute because I know Ora Pharma has some great visual aids. You know, they say a picture is worth 1,000 words. I'm going to give you one more visual aid that's really, really easy. You know, I promised you communication tools that would be easy and that would work. You know, most of our patients know what their numbers are, like their blood pressure. Most everybody knows what their blood pressure is, their cholesterol number. They may not know what it means, but they know what it is and they know if it's good or bad. What if you had two simple numbers that very succinctly told your patient what their periodontal disease was? So as a hygienist, once you've charted, if you went back and counted all the pockets, and you can determine where if you want it to be anything over 3 millimeters is considered not healthy. So let's use that, anything over 3 millimeters. Let's say you had 18 sites that were over 3 millimeters. That's your top number. And let's say some of them were 4s and some of them were 5s, a few of them were 6s and maybe 1 7. And let's say out of all of those areas, 14 of them were bleeding. So the score is 18 over 14. That's that patient's or their periodontal health score, their PHI. All right, I didn't invent this. Patricia O'Hare, who's an extraordinary hygienist. All you hygienists probably have heard of her. She's worked all over the world. She came up with this, and I thought it was brilliant because it's so simple. What would be the perfect score, Mrs. Jones? 0 over 0. We want no pockets and no bleeding, all right? So this is your score today. Next time you come, we're going to check again and see what your score is. So do you think that would be hygienists in the room? Would that be helpful too for you? A really good visual aid? The Periodontal Health Index. Your visual aids are huge. I love this right here. This picture, this Ora Pharma picture of the bacteria, the rod-shaped bacteria that are so dangerous. And the caption is, "Face it, you're outnumbered." I mean, that is clear, concise, powerful communication at its very best. All right? Very short, but very powerful message. So tools like this are great to be able to show your patients. This is what all that bacteria looks like under a microscope. And these rod-shaped bacteria are the ones that are the most dangerous. I had the privilege of being in the office of a dentist, Dr. Lisa Marie Samaha, who's a wellness practice, and they do all kinds of incredible things up there. She treats really sick people. But they have a phase contrast microscope, and her hygienist showed me my plaque as well as a bunch of other people's plaque under, or their crevicular fluids under the microscope. And it was fascinating to see. I haven't done that since being in college. But the rod-shaped ones, as she explained to me, were the most dangerous, and we found a few people that had those. But you can see that particular slide is full of them. So anytime you can use a picture to help our patients visualize what's going on is going to be really, really helpful for you. And I love the cross sections too. I think anytime you can show those cross sections is going to be helpful for your patients. So using visual aids, Aura Pharma has a lot of visual aids, and it's available on the website for you as well as through your reps. So I would encourage you to use the use what's available to help your patients visualize what's going on. Let's talk a little bit about some of the objections that we get in our office on a daily basis. And when we talk about these objections, these are things that you've heard before, so you should have a pat answer for them. So what I'm going to challenge you to do tonight is to think about the tools and techniques that you've learned so far tonight and answer them in this method. Number 1, confirm. Number 2, acknowledge. And number 3, problem solve. So the first objection is, why has nobody told me I have periodontal disease before? So who wants to take a shot at it? You're going to confirm, acknowledge, and problem solve that question. Anybody want to go? How would you confirm that? How come nobody told me I have this gum disease before? You would be confirming that by saying, Janet, let me understand you correctly. You want to know why you weren't told this before. Thanks for asking that question. I'm so glad you asked it. A lot of patients want to know that too. Okay? So you've confirmed it. You've acknowledged their concern. I don't blame you for being concerned. And then go on to let them know why would a patient be told they had periodontal disease if they hadn't been told before? Could you get it that quick in 6 months? Could you? Could you go from 3 millimeters and no bleeding to having bleeding in 6 months? Yeah, absolutely. Absolutely. So we know that periodontal disease is what? Episodic. It's like diabetes. You can be under control for a while, but then an event in your life can put you stressed out, and that can change that for you. So that's one example. Another example may be your patient moved from another office. All right. So what would you say in that case? How come my last hygienist didn't tell me I had periodontal disease? How come my last dentist didn't tell me I needed a crown back there? I can't speak for the person who saw your mouth last time, but I can tell you what I'm seeing right now. Okay? I can tell you what I'm seeing right now. What is a periodontal maintenance procedure, and why is that different from a cleaning? How would you answer that?
I always say with the history, because I get this question a lot.
Okay.
If you have a history of gum disease, you have to maintain it, and therefore it's, I say it's coded differently, which is probably the wrong thing to say. So you're no longer, a regular cleaning. That's what
So, what makes a periodontal maintenance different from a regular cleaning? I'm glad you asked that question. You know what? Almost all of our perio patients want to know that same answer. A prophy, a cleaning, is a cosmetic procedure. Okay? Your perio maintenance, and it's above the gum line. Your perio maintenance addresses all the issues below the gum line, plus we're going to be constantly re-looking at your medical history, probing much more aggressively than we would do for a prophy, to be checking all of those pockets, all of those 14 pockets, to make sure we've noticed the progress for every single one of those 14 pockets. Okay? So always try to answer questions so that it's for the patient's benefit. So every answer you give gives a patient benefit. Okay? Tamara or tomorrow?
tomorrow.
Tamara just had a great answer. She was the first one to volunteer. But she did say, I know this is probably wrong, but sometimes I say because it's coded differently. I would not say that simply because that's not for the benefit of the patient. I mean, we know that they're coded differently, but I would always try to craft my answers, remember, very specific communication, craft my answers and for what's for the benefit of the patient, okay? If I have an infection, why don't you just give me a prescription for an antibiotic? Have you ever gotten that? So how would you answer that? Why can't you just give me a script for an antibiotic? We know that a lot of our patients want to know that. Wouldn't it be easier if you could just take a pill? I know, we're a culture of taking pills, right? But we do know that if you take a systemic antibiotic, not only does it kill all the bad bacteria in your body, but it kills the good bacteria too. And it's a crisis in this country now, overuse of antibiotics, because the bacteria are building up resistance. So sometimes patients who have taken lots of systemic antibiotics, they don't work on them anymore because the bacteria have built up resistance to that. So we've got this, and I'm going to sound like I'm a little bit of a commercial now, but this is how I feel about this, and this is what I used to tell my patients. We have got this incredible technology. This technology is so unique. It is so cool. It's this little powder. We stick it down under your gums exactly where that one site of infection is, and it works for 28 days. It's like time release. This is amazing stuff, and there's nothing else like it. So why would we give you a systemic antibiotic for your whole body when it's these areas, these 18 areas in your mouth that are infected? So that's why we wouldn't give you a pill. That's why we want to use site-specific antibiotics. I use the word site-specific a lot over and over again so people get that word, site-specific. Will my insurance cover it? What do you say? No. What do you say? Will my insurance cover it?
Office manager.
Yeah.
Office manager, go see Amanda. This is a question where you need to really, really reassure your patients. Nobody likes to seem like they're cheap or they can't afford things. Everybody wants to feel like they can afford to take care of themselves. But this is a question that's asked. Let me ask you something. Do you think the only people that ask this question are the people that don't have money? No. No, absolutely not. I heard a well-known speaker once talk about, he does celebrities, and he said, you know, some of my well-known celebrity patients, some of which you would recognize in a heartbeat, asked me, hey doc, will my insurance cover this? Okay, so it doesn't have anything to do with whether you have money or not. It's just a simple question. We get real defensive about it, you know. My answer, once again, confirm and acknowledge. That I always thank people for asking questions. Questions are great. The more questions your patients ask you, that's giving you permission to what? Patient education, exactly. They're asking you for it. So questions are great. So will my insurance cover this? My answer would be, I am so glad you asked that. That's a great question, and you know, almost all of our patients want to know that. I don't know the answer to that because I don't know what your insurance plan is. That's between you and whoever, you know, your insurance plan is with. What I do know is Amanda at our front desk is absolutely awesome at making dentistry. Our practice is committed to making dentistry affordable for our patients, and Amanda is great at maximizing your insurance benefits, okay? So you may be in a position to discuss that. In most offices, there's one person who really can focus on that, and so that's the way I'd handle that. Most of the time, people just want some reassurance. They need to know the financials, the specifics, but by you utilizing all the things that we've talked about so far today, those are the types of things that are going to make you more trustworthy and more likable, the likable factor. Studies have shown that people buy from people that they like and trust, okay? Studies also show that people don't sue people they like. They don't sue doctors and dentists they like. Do you know what the number one litigation is for dentistry? The number one reason for lawsuits for dentistry? What are more lawsuits filed than anything else?
Money.
Well, yeah, for money, but for what reason? Pardon me? Huh? My dentist didn't tell me. Number one reason, failure to diagnose periodontal disease. Okay? Failure to diagnose periodontal disease. Patients don't sue people they like. So even if you've glitched on that, the likability factor is huge, huge, huge. Okay? Cardiologists are going to start calling your offices to get periodontal clearances when they do surgery. Huge. Got to find it, got to treat it. All right? Will my insurance cover it? Why is this treatment so expensive? This is a tough one. Why is it so expensive? So let me ask you a question. Do you all think that dentistry, periodontal therapy, is expensive? Just think about that, because how you feel about it is how you're going to come across to your patient, all right? If you're confident that this is a good value for your patient, what's the alternative? That's going to come across, your self-confidence in knowing that this is the best value, that you would prescribe this for your own family members if that was necessary. I have a saying, and this is it. The people in this country have the money for what they want, whether they need it or not. Who do you know that doesn't have a big old flat screen TV? All right? How many people do you know that don't have an iPad? You look at your patients when they come in, women that get the nails, all right? That's expensive to maintain. Find out about your patients. Find out what their habits are. We spend money in this country for what we want. In dentistry, our job is to make people want what they need. So think about, your core values. If you really believe in this, that will come through to your patients. Okay? That's the most important thing, is if you truly believe that this is a good value, you're going to be able to transfer that value to your patients with the things that we've talked about tonight. And can I get this procedure done later? Why would you want to wait? Why would you want to wait? Why would you want to wait to treat an infection? Okay. Anybody have any other things to add to some of these objections? Because we hear them all the time. We should have really good answers for them.
One thing that
Ready.
we learned in another seminar was today is the least expensive that it will be.
What a great answer is that?
I think that's great.
And that answers both questions. Why is it so expensive, and can I get it done later? Today is the least expensive that it's going to be. That's beautiful. I love that.
It came from you.
It came from you? Well, thank you. I'm going to borrow that. That'll be in the next presentation. Did everybody hear that? Today is the least expensive it's going to be. So we've talked about the whole patient experience, that this is a process, how to establish patient rapport quickly. We learned the patient values questions. Who can tell me what the first patient values question is?
What's the most important thing about your teeth?
Thank you. What's the most important thing to you about your teeth? And the second patient values question is?
What do you look for dental?
What's the most important thing to you about your dental office? Awesome. Okay. And then we talked about the difference between casual conversation and getting very, very focused in our communication with transformational vocabulary, the treatment triad, and those communication strategies. So can you see how that'll help you get more streamlined with that big old iceberg that we talked about, and getting down to the core of your patients? So you're treating your patients differently. You're getting to their core values and treating them differently. Not treating them differently, but presenting, customizing their presentation to tweak it to match their values. So what does successful patient communications look like for you? I would ask you, what are you going to do differently tomorrow as a result of tonight's presentation? So who can give me one or two things that they're committed to doing starting tomorrow that they've learned from tonight?
The cosmetic and functional
Cosmetic and functional. Okay, great. Oh, the PHI. I really like that. The PHI. Awesome. What else? Pardon me?
Some verbiage.
Some verbiage. Which verbiage?
The infection or inflammation versus, infection. Just,
Oh, the transformational vocabulary. Okay, great. Anybody else? Do we have any doctors in the room? One? Only one. Our token doctor. Yay, give him a hand. Woohoo! Awesome. We love our doctors because without our doctors, hygienists, how could you enroll periodontal therapy without the support of your doctor? You can't. You can't. So we appreciate our doctors. Thank you for being here. Thank you for being our token doctor. Great. This is a floral arrangement from another Italian restaurant that used to be very popular in downtown Atlanta. It's not there anymore. During my initial years of being a clinical hygienist and my later years of being a director and writing and speaking, I took a hiatus, and my passion is flowers. I'm a ikebana artist. That's Japanese floral design. And for years, I was a professional floral designer for special events. So this is one of my arrangements for that hotel. But flowers are wonderful because they're all basically this one category. So they have similar characteristics, and you treat them somewhat similarly. They all have to have their stems cut off and fresh water, and they need to keep having water to come up their stems to stay fresh. But at the same time, there's so many different varieties, and within those varieties, there's so many differences too. And the more you get to know about them, in Japanese floral design, we had this saying that, let the flower speak to you. The flower will tell you what it wants to do. So, our patients are kind of like flowers. Yes, they're all under the same category of people and patients, but the more you get to know them and find out what their values are, the more you'll be able to customize whatever treatment they're going to need and be able to find out what their triggers are, what their values are, and how you can be that patient's advocate. That's the main thing, to make that patient feel like you are there for them. You're their advocate, because that's the way you're going to get patient loyalty. That's the way you're going to get patient compliance. That's the way you're going to save the world from periodontal disease. Okay? So I hope tonight that I helped you get some tips and tools and communication tools for your toolbox that are easy and simple to use, to implement, that are going to work for you, and that will be fun for you too. So email me, let your reps know, let Adam know, let them know how this is working for you. If you have any questions, I'm accessible through them. I'm happy to give out any cards at the end to anybody who would like to keep in touch with me. So I want to thank you all. You've been a great audience, and I'll look forward to hearing your great results.